Unfortunately, we really do have a crisis when it comes to aging in our population. We are not prepared for the needs of the baby boom population as they age. And when I look at tomorrow, I want my students to be a part of that solution. Our gerontology program is the only bachelor's in gerontology that is offered in the state of Iowa.
Dementia affects so many people, and at some point it's going to affect us whether we have a neighbor that has some dementia, or we have a family member or a friend that their parents are going through it. It's one of those end-of-life stages that we don't think is going to happen, but it does. And so it's really important that we can get the education out there and knowledge to people so we can help those with dementia now.
The Dementia Simulation House is cutting edge. It's the only dementia simulation house in Iowa, and from what we know, it's one of the only dementia simulation house experiences in the US. And so to have that at the UNI campus for students to have access to and get to be a part of is huge, and it's just so important.
Individuals come in and we give them dementia for a few moments, and we have them participate in just activities of daily living to see what it's like to live with dementia. And I think it has changed the perspectives of a lot of individuals.
That includes more than just memory loss, but it's how a person interacts with their environment. And so students that get to go through that get to see that glimpse, and it increases empathy and understanding of what it's like to live with dementia.
We've also been able to serve individuals in the community, and what's been amazing about that is, yes, we have some healthcare providers, and that's wonderful, but we're also talking about people like massage therapists and hairstylists and people who work in retail, people who might work or volunteer at the library. We want to set up our whole community so that it's a place where people with dementia can live and live successfully for as long as possible.
Looking back over my career of working in healthcare, I started as a CNA, and I told Elaine the first time that we met and talked, I said, I wish I would have had this information. I didn't know a lot to do with people with dementia, and I tried my best, but information of what this house is going to provide, I think will really open up the eyes of family members, along with professional staff that work with someone with dementia on a day-to-day or week-to-week basis.
Dr. Eschbach is the one faculty member in the gerontology program right now, and she's amazing. And she, obviously, as I already mentioned, she brings so much to the program. But with aging, there are so many facets to it, and as people age, they're facing lots of different things, including needing to age in a healthy way. They need to continue to exercise, have healthy nutrition. They're also facing some social challenges. So there's a lot that goes into aging. So to have more faculty members that could help focus and specialize in different areas in aging would really take the next step for the program and help the program be more well-rounded and prepare professionals as they work in the field. So to have more faculty members would really complete the program.
We feel like an investment in our program means that we will be able to do a better job producing a workforce that is prepared to work with people as they age. And that is not only people who are sick and need direct care, but it is to give older adults opportunities to thrive in communities and continue to live and do what they want as long as they possibly can.